right, thank you very much. Dr. Kuntz, what were the pain points that you guys were experiencing that you were looking to address with the AI platform and Icometrix?
So, a number of years ago, we started exploring artificial intelligence algorithms for our hospital, and it was mainly kind of to get our feet wet in this burgeoning community because we wanted to get our experience for both our clinicians and also just making sure that we were kind of keeping up with the evolving technology. So we've engaged with a couple of vendors, and we have several algorithms running currently at Leahy. We have algorithms for intracranial hemorrhage detection, cervical spine fracture detection, LVO, perfusion, and recently we've also adopted volumetric MR analysis for our dementia patients, and we treat an exclusively adult population at Leahy. And so Alzheimer's, dementia, and multiple sclerosis are a big portion of what we see in our daily practice. So we were looking for some assistance. And I think our approach is a little maybe different because we're not a research institution. We really look for our clinicians to kind of establish what they need to work with. And as Alzheimer's was becoming a bigger part of what our clinicians were seeing, they wanted to have more data to essentially help them make a decision of whether a patient was suffering from Alzheimer's dementia specifically, whether they're to maximize essentially the information that we were getting from MRI in order to direct treatment decisions and maybe have a patient have a confirmed diagnosis of Alzheimer's dementia. So that's where we are at this point.
All right, thank you. Dirk, how does Icometric solve or address that pain point?
Yeah, absolutely. So at Icometrix, we tried to develop AI algorithms for neurological disorders and multiple sclerosis, Alzheimer's disease, and related dementia are very key there. What I think is important there is that the new treatments that are in the space, they require more data to get the right patients on the right treatment. We know it already for a long time in multiple sclerosis, but now also recently in Alzheimer's disease, these treatments are there. And I think with these data, we can somehow address the needs that are there, the pain points that are there in clinical practice, and like make a more data-driven decision-making, have risk assessed early on such that patients with higher risk are not starting the treatment, and patients on the treatment that we identify risk factors early on such that there is no severe impact of the treatments on those patients.
Perfect, thank you. All right, Dr. Kuntz, this one's back to you. What other areas do you think AI can help with at Leahy Hospital?
I think there are a number of areas. I mean, I think at this point we're looking not only at image analysis tools, but obviously, you know, there's a whole area that AI can influence in terms of workflow organization, image acquisition, speeding up images, making image quality better with regard to MRI. And of course, when you're looking at an MRI, you're not just there's so much data acquired there, and here at RSNA we're seeing a lot about, you know, the data that's contained within a specific organ or that you're able to capture with an imaging modality is just the start. So there's so much that we have the potential to capture in the future. But I mean, I think what we're looking at, because we see Alzheimer's dementia and multiple sclerosis, the tools that we're looking for now that we have some amyloid-related therapies is trying to, we have patients that are on protocols to receive some of these amyloid therapies, and when there are complications associated with those, obviously everybody's suffering from longer and longer work lists. We want to make sure that those positive cases where there's either ARIA-E for edema or ARIA-H, that those are kind of prioritized on our work list, that we can make sure that those findings are communicated early and quickly to the referring clinician, and that might make a big treatment decision for them in terms of whether the patient can continue on the therapy or not. So I think there's more ways that that we could probably utilize that right now, and then of course in 2 years to come, who knows where we'll be.
Dirk, as Dr. Kuntz mentioned earlier, there were specific workflows that they addressed. Can you mention any other adoption techniques that organizations can look at in their hospitals moving forward with the adoption?
Yeah, absolutely. I think Dr. Kunst raised a very important point here with these anti-amyloid treatments. Patients get regular infusions. For one drug, it's every 2 weeks, and for the other drug, is every month. What is crucial is that the outcome of the radiological read, preferably enhanced with AI, is known and processed before the infusion is actually given, because otherwise there might be the risk that there is a reason to stop the treatment that is not seen at before that the treatment is given. So there is a coordination of care is super important for this, and we're speaking about high volumes. There are so many Alzheimer's patients in this country. We're speaking also about a lot of MRI scans, 3 safety extra safety MRIs for one, 4 for the other drug. This means a lot of coordination, and I think workflow orchestration is super important here. And again, there's platforms playing an important role.
Just quickly add something to that, just because I think one of the things that we've seen in our practice is kind of, rolling information out to a group of neuroradiologists. So when these new amyloid-related imaging abnormalities were coming about, how are you going to educate an entire team? And we have a relatively small team that we can educate, but if you're working in a large organization, or when you have a community practice with a number of different radiologists, maybe not all of them are neuroradiologists, how are you going to educate them in terms of the imaging appearances of different amyloid-related imaging abnormalities? And this is where, honestly, AI can have the potential to not only help you, but actually serve in a feedback loop to educate the radiologist about the different findings. So we're finding that it's not only prioritizing, but it's also a way of kind of getting the radiologist, you learn to look at the images differently. The volumetric analysis allows you to kind of look back at maybe now head CTs and see the atrophy patterns in a different way. So it's interesting how it's evolving in our practice to kind of educate us and yes.
Perfect. Thank you. Maybe we'll see if this helps at all. So, thank you. Perfect. So, a couple things that we have to challenge is use versus adoption. So we have a lot of use, but how do we get clinicians to actually adopt the AI and trust the results moving forward? Do you have any advice for other clinicians to capture adoption versus just usage?
I have a lot of experience. I wouldn't say I've nailed it. But I think honestly, with artificial intelligence, and we had a chairman for a long time who was just very proactive when it comes to this. So at some point, if you want to get on the bandwagon, you just have to get your feet wet. And so you have to look for a vendor partnership that's going to allow you to get your feet wet. And then you can kind of start tweaking and finding ways to incorporate that into your practice. And hopefully that's disseminated and democratic and everybody's on the same page. And you guys kind of pick individual tools and kind of incorporate them. I think communication is key, and we had the fortunate coincidence of when we were kind of starting to adopt AI, that we also developed something called a peer learning program where we were kind of going over cases. And so we actually combined the two, and we decided to look at troublesome cases that we could maybe find an artificial intelligence tool to address. And so that's how we kind of disseminated the information and also kind of broke down barriers in terms of individual radiologist comfort level, because everybody started getting on the same page. And I think that's one useful tool. Communication is key. With people reading in different workspaces and maybe even in different time zones, it becomes challenging. But I think if you're going to adopt something like this, especially with different generations of radiologists and different people with comfort level from incorporating technology, it's important. And then we've done a lot of kind of our own internal validation. And we've kind of looked at different products, and being able to compare those products on individual patients, I think, has been really good in terms of getting radiologists comfortable with the technology.
Maybe there's also something I would like to add from the vendor side, because as Icometrix, we now have an Icobrain CPT code. That's a new category 3 code, which means it's a temporary code which already gives us payments for the utilization of the software. But in order to make this a sustainable category 1 code, we need to demonstrate that the software is impacting care. And impacting care means we need to go beyond utilization of the software to adoption, and adoption to the extent that we can hopefully improve the patient outcomes, because that is ultimately what payers are interested in too, to make sure that the software, the AI, is really having a benefit. Of course, there's workflow benefits, but these CPT codes, they particularly look at clinical necessity and clinical impact, and their adoption is so key, because otherwise it ends up in just being an algorithm sitting somewhere on anywhere in a computer. It needs to be like part of the workflow, bringing improved patient outcomes.
And I would add on that you know, having an AI tool that's just living on a workstation somewhere and not incorporated is not only not helpful, it can potentially be harmful, because there's ultimately cases that an AI might pick up that a radiologist will miss. And so, you know, I don't think there are necessarily at this point kind of legal pathways, but at least, you know, that's something you want to make sure that you're maximizing all the benefits of the technology, obviously, if you're going to use it. Ways to incorporate it into your workflow. I know that at Leahy we've kind of incorporated that we look at all the imaging studies first, then we check the AI tool, make sure that it's correlating. If there's a discrepancy, then you know, we can choose to kind of incorporate that into our report or not, just to make sure that the clinician that's receiving our report and the automated report knows. So, and we're small enough as a hospital that we have the clinicians' trust, and so they know that when they're hearing it from us, you know, they take it with a, yeah, they trust it a little bit more.
Well, Dr. Kuntz and Dirk, I'd like to thank you both for joining us today, and thank you very much.